My name is Dr. Nazlee Zebardast. I am a glaucoma specialist at Massachusetts Eye and Ear Infirmary and Harvard Medical School in Boston, Massachusetts. I am a glaucoma specialist and a clinician scientist. That means that I spend my time doing research as well as taking medical and surgical care of glaucoma patients. Every day, I see patients nearly blind from glaucoma. And I can't help but wonder, why are people going blind from this disease in 2020? And more importantly, what can I do to prevent this? Glaucoma is a disease of the optic nerve, resulting from retinal ganglion cell degeneration. It leads to gradual, progressive, and importantly, irreversible visual field loss, and is a major cause of blindness worldwide. In fact, it accounts for 14% of global blindness. This disease is estimated to affect 3.5 to 4% of the general population over the age of 40. That means 75 million people globally, and projected to increase to 112 million by 2040 due to the aging of the world population. Even at early stages, glaucoma vision loss is associated with poor quality of life, increased falls, decreased mobility, and increased economic burden. The annual burden of glaucoma treatment in the United States is estimated at $5.8 billion, with an additional loss of productivity as a result of vision loss estimated at $2.9 billion annually just in the US. Because of the relatively slow loss of vision, glaucoma often does not come into clinical attention until significant vision loss has occurred and is commonly known as the silent thief of sight. In fact, population-based studies have shown us that even today, 50% of glaucoma cases in the United States go undiagnosed, and many have significant vision loss at the time of diagnosis. The rate of undetected disease is even higher in minority populations and elderly populations in the US. While there is no cure for glaucoma, early detection and treatment by lowering the intraocular pressure can slow disease progression and save vision. Because of the silent nature of disease, the only way to find early disease is to screen for it. Therefore, it is clear that effective methods, are needed to screen people for early disease. These are of paramount importance. But to complicate this, we know that glaucoma is also a heterogeneous disease with variable disease course. While some patients progress to blindness, many others left untreated never progress to glaucoma-related vision loss. We currently lack the ability to pre-symptomatically distinguish patients at risk of severe and progressive disease from those unlikely to progress to glaucoma-related vision loss. The goal of my research is to use precision medicine-based approaches to improve our assessment of disease risk for any individual. Detecting glaucoma earlier and accurately assessing individual disease risk will significantly reduce cost and burden of blindness. My team is doing this by using cutting-edge genomics and artificial intelligence technology. Glaucoma is highly heritable. In fact, the most heritable of all complex human diseases. Multi-ethnic genome-wide association studies to date have identified 127 novel genetic loci for this disease. In addition, machine learning is a type of artificial intelligence, an incredibly powerful technology that is transforming our lives and how we practice medicine. Healthcare, especially ophthalmology, is data-rich, and machine learning methods are helping us make sense of this data in order to improve patient outcomes, increase accessibility, and decrease costs. My team is using cutting-edge machine learning methods to discover novel image-based biomarkers or endophenotypes for primary open-angle glaucoma. These phenotypes essentially characterize any individual's type of disease and their progressiveness of their disease. These phenotypes can then be used to understand the genetic underpinning of glaucoma and its clinical course. Using this information and a comprehensive set of genetic risk factors and advanced computational biology methods, we are constructing individualized genetic risk scores. The combination of genetic risk scores and imaging features will be used to detect glaucoma and develop screening and diagnostic tests in order to reduce cost and, more importantly, burden of blindness in the US and globally.